Hey guys, Chris from Paramount Retirement Solutions, and we're in video number 4 of our Understanding Medicare, figuring out what you need to do when you first turn 65 and are eligible for Medicare in this series here. Video 1 talked about how to get signed up for Medicare. Video 2 talked about what Medicare covers and where the gaps are. Video 3 talked about the path on the left in our Medicare block diagram, showing how to get signed up for those insurances and the way it works with Medicare. And now video 4 here is going to talk about the path on the right, and it's going to be all about Medicare Advantage plans. So like I mentioned in the last video, you can only go down one path or the other. So if you decide to take the fork in the road down the path on the right, those are known as Medicare Advantage plans. As you can also see on the chart here, Medicare Advantage plans are often known as Part C of Medicare. So if you kind of understand it and are a little confused, okay, I have to get Part A and Part B, I have to get Part D because that's my drug coverage. Well, don't I have to get Part C? No. Part C of Medicare are the Medicare Advantage plans, and you can see that those are optional. So if you go down the path on the left, then you're not going to be enrolled in Part C. So something that's important to realize with Medicare Advantage plans is you need Part A and Part B to be effective. So that means you have to pay your Medicare Part A and B premiums. Like I mentioned in video 2, 99% of folks don't have to pay a Part A premium. However, Part B, you've got to pay a premium for it. So if you sign up for a Medicare Advantage plan, there's generally a premium to go along with the Medicare Advantage plan, and you need to pay your Part B premium because in order to enroll in a Medicare Advantage plan, you need to have Part A and Part B effective. So how does it differ from the path on the left? Well, let's start out by talking a little bit about how Medicare Advantage plans work behind the scenes. Whenever someone signs up with a Medicare Advantage plan with a particular insurance company, now they're actually signing up with that insurance company's plan, and now that insurance company is their managed care provider. This means that technically and temporarily, the Medicare beneficiary is not enrolled under original Medicare anymore. What's now happening is that Medicare now gives funding to a Medicare Advantage plan. The figures that I've heard is that Medicare now gives about $600 to $900 a month of your Medicare dollars to the insurance company that's providing your Medicare Advantage plan. And now they're taking on the complete liability of providing your health care. So if you have a fairly good health year and you don't use your coverage a whole lot, then generally the Medicare Advantage plan will make a profit. However, if you have a bad health year, you spend a bunch of time in the hospital, you need a lot of procedures done or maybe a couple different surgeries, and your total healthcare expenses are $300,000. The Medicare Advantage plan is responsible for providing your health care. Even though you're not enrolled under original Medicare anymore and following the rules of the Medicare Advantage plan, everything the Medicare Advantage plan wants to do has to be signed off on by Medicare. Every copay it charges, every deductible it assigns, every premium it wants to take out of your Social Security check, Medicare has to approve that. So keep in mind that all of those cost sharings that we talked about in video 2 about the different Medicare Part A deductibles, Part B deductibles, and the co-insurances, those amounts don't technically apply because a Medicare Advantage plan is now responsible for setting your out-of-pocket amounts. They'll tell you how much that your copay is at the doctor, how much you'll have to pay for blood work, for each day in the hospital. So that's the way a Medicare Advantage plan works. All right, so let's start taking a look at some of the differences between the path on the left and the path on the right. One of the biggest differences between Medicare Advantage plans and original Medicare with a Medigap insurance is with Medicare Advantage plans, they're all going to have networks that you need to stay within. Most of those plans are going to be HMOs, they're going to be PPOs. Those are just acronyms for healthcare plans that have a group of doctors and hospitals and healthcare providers that take that particular managed care plan. So if you want to see a doctor or go to a facility outside of your network, that's going to mean that you're either not covered or you're going to pay a higher out-of-network rate. One thing to keep in mind though, if it's an emergency and you see somebody out of your network, you're still going to be covered as if you were seeing somebody in network. So if you go outside a network, Outside of your network, you're going to have to pay a higher out-of-network rate. Also with HMOs, most times you're going to need a referral if you want to see a specialist. With a PPO, you generally don't need a referral to see a specialist, and with original Medicare, you're never going to need a referral in order to be able to see any specialist you want to. So with Medicare Advantage plans, there's going to be more hoops to jump through, if you will. You're going to have network restrictions. You're many times going to have to get referrals to see the doctor that you want to. So that's something to keep in mind if you do decide to go down that route. So another difference with Medicare Advantage plans compared to original Medicare with a Medicare supplement is that your potential out-of-pocket expenses with a Medicare Advantage plan are much, much higher. Basically, you're going to pay for your Medicare Advantage plan every time you use it. Things that are covered at 100% by Medicare generally are going to be free. You're not going to have to pay for those. But every time you see the doctor, every time you get a test done, every procedure, any surgery, every day in the hospital, for your prescription coverage, generally every time you use your plan, there's going to be something to pay for out of pocket. Now, every Medicare Advantage plan will have something called a maximum out-of-pocket amount. Basically sets a limit on your potential liability for the year. However, from what I've seen, every maximum out-of-pocket amount ranges anywhere from $3,000 to $10,000. So if you have a bad health year, generally you could spend thousands of dollars in out-of-pocket expenses. Compare that to getting a Medigap policy down the other path. If you have original Medicare, look at Plan G. The most that you'd spend out of pocket would be a $183 deductible, then Medicare and your Medigap plan would pay for everything else that you need done. But if you look at some of your benefits of a Medicare Advantage plan, the big one is price. You have a lower average premium getting a Medicare Advantage plan compared to your average premium of signing up for a Medigap plan with your own drug plan. You'll have to pay a premium for the Medigap plan, you'll have to pay a premium for your standalone drug plan, so on average your Medicare Advantage plans do have a lower premium. And the reasons for that is because there are some restrictions. You're having to stay within network, possibly getting referrals to see a specialist, and dealing with potential much larger out-of-pocket expenses if and when you do use your plan. Another benefit of Medicare Advantage plans is comparing it to original Medicare. Medicare does not offer routine vision, dental, and hearing coverage. Now, anything medically necessary, like if you look at cataract surgery for your eyes, or any eye diseases like macular degeneration or glaucoma, Medicare is going to cover the medically necessary costs for those. But anything routine, like routine eye exams, getting a new pair of glasses, any routine dental, like getting a cavity filled, having your teeth cleaned, things like that, Medicare doesn't pay for any of that. However, Medicare Advantage plans will often throw in some type of routine vision, dental, and sometimes hearing coverage. So that is one level of benefit that you get with a Medicare Advantage plan that you don't get with the path on the left, so to speak. However, keep in mind that your vision and dental coverage are usually limited to preventative services. So dental coverage, for example, might cover 2 cleanings every year, might cover a round of oral exams and a set of x-rays. However, if you need a root canal or an extraction done, then generally you're going to pay for those out of pocket. So in summarizing kind of the big picture between the 2 different paths, we can take a look at the chart. It just highlights some of the benefits, some of the pros and cons about going down either side. One last thing to consider though is if you're turning 65 and you're getting on Medicare for the first time, you are in what's known as your Medigap open enrollment period. It only is a one-time period in your life. It lasts for 6 months, and it starts the day in which you both turn 65 and get on Medicare Part B for the first time. You can get a Medicare supplement, a Medigap plan, with no questions asked during this time. However, if you get a Medicare Advantage plan now and start to use your coverage because you're going through some health issues and you're managing some chronic conditions, if you want to then later go and get a Medicare supplement plan, you may not be able to, or you may be restricted in your choices because now you're going to have to answer health questions. Okay, so that is basically how Medicare Advantage plans work and how Medicare Advantage plans differ from getting a Medigap policy with a standalone prescription plan. The last video in the series is going to wrap everything up It's going to explain how to find the best coverage for whatever path you've decided to go down. So stick around.